Hi everyone, my name is Cbae and I'm a clinician here at MedPsych Associates. Today I have a special guest, Dr. Jason Park. If you could actually introduce yourself, that would be great.
Yeah, thanks for having me, Christine. Like Christine said, my name is Jason Park. I'm a physical therapist and a solo practitioner of my own company, Elevate Performance Therapy. And we're located, I rent space in a gym in Englewood called Phoenix. It's a small boutique personal training gym. But I started off as a mobile therapist, meaning I was going to people's homes or going to offices so that they would, it'd be more convenient for them. I still do both, but, most of my work has transitioned into being here in the office.
Cool. And I imagine, was that also after kind of COVID occurred?
It's funny. I got this spot pretty much like a month before, like in February. I think we kind of sealed the deal and I was moving in. And then all of a sudden, COVID happened. So, timing is interesting, but yeah, still grateful for everything that's happened. And yeah, looking forward to kind of progressing from here on out.
So something I wanted to talk about today is something that I've been seeing personally with my clients that I work with, as well as new clients who are coming in. Prior to COVID, a lot of the symptoms that would bring people into my office were starting with mood and behavioral changes. So whether that was anxiety or depression, that was the first thing they noticed. But lately, because of the situation we're in with the world, people think, their mood changing and behaviors changing and anxiety starting up is pretty normal. And so they're actually seeing a lot more symptoms presented in the body in the form of, let's say, headaches, backaches, neck pain, shoulder pain, fatigue, all of the above. So in this situation, if people are not really seeking help for mental health, but they are physically exhibiting symptoms that are causing pain, would you recommend them seeing somebody like yourself or, physical therapist to help with that?
Yeah, I think that's definitely a conversation that's worthwhile having if somebody is having physical pain because, like you said, some of those things, their behaviors have changed, their coping mechanisms have changed. Maybe anxiety has caused change of breathing patterns where, people are using a lot of tension or having a lot of tension up here and breathing and having these quick, short breathing patterns versus allowing the lungs to actually expand. And, that does oftentimes cause pain into the jaw, the head, the neck, right? All in this region most commonly. So even most of my, patients that I see for their neck pain or shoulder pain, desk workers, it's the same thing. Everyone just kind of rides up in here and it becomes problematic. And even just patients that maybe aren't most anxious or, they just have neck pain, sometimes they leave saying they feel less stressed. They feel lighter, things like that once the alignment gets better. So I think it's definitely worth a conversation, for some people that, are dealing with that physical types of pain.
I like how you brought up, the short breaths, because one of coping skills that we really teach and have our clients practice is deep breathing. And I know in physical therapy, that's also a thing, like proper breathing is important, right? Part of
Sure.
treatment.
Yeah. There's actually a whole school of thought and training that, it's really all about positioning and it's all about breathing. And it's really setting allowing the diaphragm to work because that's a core muscle. And if you can't really tap into the diaphragm, then, you can't really strengthen your core properly, but also you can't really find the positioning between your ribs and your pelvis. And then the spine is the powerhouse that kind of controls everything else. So, when you can't breathe properly, chances are, it's going to be very hard to set down the baseline or the foundation of improving movements and improving strength.
So that is important for holistic health, I would say.
Sure.
Right?
Yeah.
Thanks for sharing that. It's cool to get that different perspective. So since there is actually a really close relationship between depression and physical pain and symptoms, or even lack of physical activity, is there anything that you recommend for people who are dealing with this at this time? Is it that they have to figure out different movements that work for them, or any exercises?
Yeah, I mean, so the beauty of, you and I were both in service industry, right? And, the reason why I started my practice was to be able to give people more time, where in healthcare today, that's very rare. If you go to a primary care, you're getting maybe 10 minutes. If you go even to a physical therapist, most often you're getting maybe 15 minutes hands-on with that therapist. And it's not enough time for people to be like actually listened to and really understand what their needs are, first off. And, until you know what they're looking for and how you can help them, it's a very tough place to be to really help. And, dealing with physical pain obviously brings on a lot of emotional stress, or vice versa. And having extra time with my patients now, doing 1-hour sessions, it's really nice where I can get a full picture, or being in their homes, I get a full picture of their day. And working with my patient today who just lost, had a death in her family. Yeah, you could tell her, you can see her shaking. She's very anxious, shallow breathing. Physical pain is probably the last thing that I'm really making an impact on. I'm just talking to her, I'm listening to her. I'm trying to just do more hands-on to calm her down and just be positive. And I think it's just the human connection, right? It's just that interaction where sometimes I honestly believe, like, as physical therapists, it's not just physical. It's this all around approach. The moment you spend time listening, they feel better already, so I think there's a lot of overlap there.
Yeah. And I think along with that, what you were sharing is, we talked about this before, that it's really about this rapport and trust and relationship, where it takes some time and it takes that trust to build up. And then you're in a place where you can recommend treatment, where you can, encourage them to seek further treatment if that's what they need. And I think you were sharing before about that situation in itself where, she may be benefiting also from maybe a therapist working with her grief and loss. And so being able to kind of encourage our patients and our clients to seek holistic health, right, and work on things that they really need that could be more urgent than body or therapy, is, I think, really important in our field of work, because we're caring and we're ministering.
Yeah.
We want them to be good in all aspects of their health.
Right. I always say, like, relationships first and patients second. And I think that's what, I want my practice to be kind of found upon. But yeah, I think there's so much overlap in our industries or in our professions. But yeah, going back to the example of my patient that I saw today who had a loss, is just really trying to assess her and where she is in that process. Like previous sessions, she cried in the car before coming in. I didn't even think she would actually come in, but she did. And, it's just giving her that reassurance, hey, like, that's awesome you came in, just trying to stay positive, or give her that positivity. But also trying to see, like, okay, where is she, so that, do I have to make an appropriate referral out to, someone like you? Because I honestly didn't know how to respond the first day. All I could do was listen and tell her that, I'll be here. But that's also not my expertise. So, I can help her, continue that plan of care. I could kind of make that treatment session a little bit more softer, less exercise based. Whatever she wants, she's going to kind of dictate that, and we're going to make her just feel comfortable. And for me, that's okay, because I'm not going to change her life like this, right? So things take time. But it's just really kind of planting the seeds, like, hey, have you had other losses before, and how did you deal with it? What is her coping strategy like? Is this normal for her, or is this kind of blown out of proportion because of other things on top of the death, right? And then just saying, hey, have you worked with a grief counselor before, or a therapist? And just trying to figure out how she responds, because maybe she's in denial, or maybe she doesn't want to be pushed that way, but it's just planting those seeds so that when the time comes, I can say, hey, go see my friend Christine, go see this therapist, they're going to help you. And I can't, because it's not what I do. And I think, overall, if you put that person first, it's not about me. It's really about that person getting better. And if that's a barrier to her physical pain and her getting better, then, no matter what I do, no matter how good the approach is or how good the exercises are, there's something missing that's going to hold her back. So we got to kind of get rid of those secondary barriers too sometimes, for them to, become the best that they can be, based on what the goals we set out in the beginning.
Yeah, you said that really well. I think that's my goal too, right? I want to make sure that the person I work with has the best quality of life, whether I can be at the forefront of it or I'm at all the way at the end and I'm not a priority. I think it's so nice to know other professionals in the healthcare field, but also, in this line of work, who truly care about the people they work with. And yeah, I appreciate you for that. Thank you for coming on. Thank you for sharing your expertise. And we'll link your information at the YouTube description box, so people can also reach out to you if they can benefit from physical therapy or just want to get a consult to see how they can incorporate that.
Absolutely. Yeah, thanks for having me. And it's nice to see you guys, connecting with other providers too in the area. So I'm happy to do that whenever. Obviously, everyone's at a different comfort level, so just giving people options to say, hey, jump on a video call for a consult, and then if you feel comfortable, you can come on in. Which a lot of people have felt more comfortable as they do like temperature checks and make sure I'm cleaning before, after, right in front of them, so they just get that peace of mind. But yeah, if anyone needs my services or has any questions at all, just, my website's elevate2perform.com with the number 2. And I'm in Englewood, New Jersey.
And we will definitely write that down too. I think it's cool. Yeah, sometimes people need a direct link. So it's elevate2perform.com.
Yep.
And you're located in Englewood, New Jersey. And we will also link the information below.
Yes.
Thank you so much for your time, and I'll see you soon.
Thanks for having me.
Bye.
Bye.